What is the most serious potential adverse effect of rifampin use? A. Liver failure. B. Gastric ulceration or bleeding. C. Nephrotoxicity. D. Seizures. The answer is A. Liver failure. Hepatotoxicity and potential liver failure are the most serious potential adverse effects of rifampin use. Patients on this medication must establish baseline liver function tests and be monitored for liver damage. None of the other conditions listed are associated with rifampin use. Aminoglycosides are primarily used for infections by what type of pathogen? A. Yeast and fungi. B. Both gram-negative and gram-positive bacteria. C. Gram-negative bacteria only. D. Gram-positive bacteria only. The answer is C. Gram-negative bacteria only. Aminoglycoside antibiotics are used to treat gram-negative bacteria. They have not been shown to be effective against gram-positive bacteria and are not antifungal. Recall the major difference between the gram-negative and positive bacteria are their cell wall composition. Gram-negative have a small proportion of peptidoglycan and a high proportion of lipopolysaccharide, while gram-negative bacteria have a large proportion of peptidoglycan. Which of the following is an example of an aminoglycoside antibiotic? A. Streptomycin. B. Clindamycin. C. Erythromycin. D. Azithromycin. The answer is A. Streptomycin. The only aminoglycoside antibiotic among those listed is streptomycin. Other examples of aminoglycosides include tobramycin and gentamicin. All aminoglycosides either end in mycin or mycin. However, this suffix is not exclusive to aminoglycosides. It is also seen in the macrolides, erythromycin and azithromycin, and both macrolides, and in lincosamides such as clindamycin. Fluoroquinolones such as ciprofloxacin may cause which of the following serious side effects? A. Seizures. B. Liver failure. C. Irreversible peripheral neuropathy. D. Sudden tendon rupture. E. All of these. The answer is E. All of these. Fluoroquinolones, the most commonly prescribed of which is ciprofloxacin, carry a risk of all of the following adverse effects: sudden tendon rupture or tendinitis, hepatotoxicity or liver failure, seizures, and permanent peripheral neuropathy. Other adverse effects include Clostridium difficile-associated diarrhea, bone marrow suppression, Stevens-Johnson syndrome, tremors, and psychosis. The majority of these adverse effects are seen in higher numbers in children and the elderly. Which of the following antibiotics is least likely to cause Clostridium difficile overgrowth and Clostridium difficile associated diarrhea? A. Vancomycin. B. Clindamycin. C. Amoxicillin. D. Ampicillin. The answer is A. Vancomycin. All of the drugs listed frequently cause Clostridium difficile overgrowth and Clostridium difficile associated diarrhea except vancomycin, which is often used as a treatment for persistent Clostridium difficile infections. Which of the following antibiotics is contraindicated in pregnant women and small children due to its tendency to irreversibly stain developing teeth? A. Fluoroquinolones. B. Tetracyclines. C. Beta-lactam antibiotics. D. Aminoglycosides. The answer is B. Tetracyclines. Tetracycline antibiotics are contraindicated in pregnant women and small children due to their tendency to irreversibly stain developing teeth. They can also affect fetal bone growth and so are pregnancy category D, known incidence and risk of fetal harm. Which of the following antibiotics is considered safe in pregnancy? A. Gentamicin. B. Levofloxacin. C. Doxycycline. D. Amoxicillin. The answer is D. Amoxicillin. Of the antibiotics listed, amoxicillin is the only one considered safe in pregnancy. Doxycycline and gentamicin are both pregnancy category D, known to cause fetal harm. Levofloxacin is category C, fetal harm cannot be ruled out. Penicillin is used to treat what type of microbe? A. Gram-positive bacteria only. B. Fungal infections. C. Gram-positive and gram-negative. D. Gram-negative bacteria only. The answer is A. Gram-positive bacteria only. Penicillins belong to a larger class of antibiotics known as beta-lactams. These antibiotics inhibit cell wall synthesis and are exclusively used to treat gram-positive bacteria. They are not effective against gram-negative bacteria or fungi. The answer is A. Fluoroquinolones. Fluoroquinolones are considered to be the treatment of choice for E. coli infections due to their effectiveness in relieving diarrhea and minimal serious adverse effects. Aminoglycosides and beta-lactam antibiotics may also be effective, as a second choice. Which of the following class of antibiotics is considered the first-line treatment for E. coli infections? A. Fluoroquinolones. B. Tetracyclines. C. Macrolides. D. Aminoglycosides. The nurse considers administration of gentamicin. Which of the following is not a side effect of this medication? A. Nausea. B. Nephrotoxicity. C. Ototoxicity. D. Diaphoresis. E. Anorexia. The answer is D. Diaphoresis. Gentamicin, an antibiotic and aminoglycoside, inhibits protein synthesis of gram-negative bacteria. It treats severe systemic infections. It may cause ototoxicity and nephrotoxicity, as well as anorexia, nausea, vomiting, and diarrhea. Diaphoresis is not a common side effect of gentamicin. Diaphoresis is the medical term used to describe excessive, abnormal sweating in relation to your environment and activity level. It tends to affect your entire body rather than a part of your body. This condition is also sometimes called secondary hyperhidrosis. You are the nurse taking care of a patient who is being treated with levofloxacin, a fluoroquinolone antibiotic, for pneumonia. Which of the following choices best describes the mechanism of action of fluoroquinolone antibiotics? A. Disruption of peptidoglycan cross-linkage. B. Inhibition of topoisomerase II. C. Disruption of mycolic acid synthesis. D. Inhibition of peptidoglycan synthesis. E. Blockage of tRNA ribosome, mRNA complex binding. The answer is B. Inhibition of topoisomerase II. This is the mechanism of action of fluoroquinolone antibiotics, such as levofloxacin. The other choices are incorrect for the following reasons: blockage of tRNA, ribosome, mRNA complex binding is the mechanism of action of tetracycline antibiotics. Disruption of mycolic acid synthesis is the mechanism of action of various antifungal agents. Disruption of peptidoglycan cross-linkage is the mechanism of action of vancomycin. Inhibition of peptidoglycan synthesis is the mechanism of action of beta-lactam antibiotics. You start a 32-year-old, HIV plus Caucasian male on acyclovir, Zovirax, for a herpes simplex virus, HSV, infection. What is the mechanism of action of acyclovir? A. Acyclovir binds to the hydrophobic sites on the influenza virus capsule. This destabilizes the virus, not allowing it to attach to the cell. B. Acyclovir prevents viral uncoating and inhibits production of viral mRNA. C. Acyclovir serves as a captoviral mRNA and prevents binding of reverse transcriptase. D. Acyclovir binds to ICAM1, preventing viral attachment. E. Acyclovir is phosphorylated by viral thymidine kinase and used as a defective guanosine analog in viral DNA synthesis. The answer is E. Acyclovir is phosphorylated by viral thymidine kinase and used as a defective guanosine analog in viral DNA synthesis. Acyclovir is converted to acyclovir triphosphate and incorporated into the synthetic pathway for viral DNA as a guanosine molecule. The initial phosphorylation of acyclovir is carried out by viral thymidine kinase. Acyclovir has a higher affinity for viral thymidine kinase than mammalian thymidine kinase. Therefore, acyclovir is specifically effective in virally infected cells. Identify the antiviral agent that blocks assembly of pox viruses by inhibiting viral protein synthesis. A. Phosphanoacetic acid. B. Dideoxyinacine. C. Methizazone. D. Amantadine. E. Azidothymidine. The answer is C. Methizazone. Methizazone blocks synthesis of viral mRNA and proteins. This is especially evident in pox viruses. Methizazone has been used to treat smallpox. Smallpox was caused by two variants, variola major and variola minor. The risk of death following contracting the disease was about 30%, with higher rates among babies. Often those who survived had extensive scarring of their skin, and some were left blind. The last naturally occurring case was diagnosed in October 1977, and the World Health Organization, WHO, certified the global eradication of the disease in 1980. Smallpox is one of two infectious diseases to have been eradicated, the other being rinderpest in 2011. One interesting question for you. If smallpox is caused by variola virus, then what is great pox, and what is it caused by? I will give you the answer towards the end of today's questions. You are prophylactically treating a 84-year-old Caucasian male with amantadine and vaccination for avoidance of an upcoming influenza outbreak. The patient is to receive 100 mg BID for 8 days. What potential side effects would you look for with amantadine toxicity? A. Hyperbilirubinemia, nausea, jaundice. B. Low blood pressure, bradycardia, premature ventricular contractions. C. Nervousness, insomnia, anxiety. D. Elevated BUN, hematuria, nausea. E. Leukopenia, anemia, increased susceptibility to infection. The answer is C. Nervousness, insomnia, anxiety. Amantadine affects the central nervous system, producing mild, reversible disturbances. High dosages have been reported to induce seizures. Cases of invasive pulmonary aspergillosis occur in severely immunocompromised patients. The drug of choice for the treatment of these infections is A. Fluconazole, B. Griseofulvine, C. Amphotericin B, D. Ketoconazole. The answer is C. Amphotericin B. Aspergillosis is an opportunistic fungi. The opportunistic mycoses are a group of fungal infections that occur almost exclusively in immunocompromised patients. Examples are zygomycosis, candidiasis, cryptococcosis, and aspergillosis. Aspergilli are widespread in the environment, and their conidia are easily dispersed and inhaled. These organisms are capable of causing a pulmonary infection in the immunocompromised patient, which rapidly disseminates and causes infection in virtually every organ. The drug of choice for the treatment of these infections is amphotericin B. A polyene macrolide antibiotic, amphotericin B works by forming pores in the fungal cell membrane. The other listed compounds are antifungal agents, however, their selectivity makes them unsuitable for the treatment of aspergillosis. Which of the following is atotoxic and nephrotoxic? A. Erythromycin, B. Doxycycline, C. Gentamicin, D. Ceftriaxone, E. Ampicillin. The answer is C. Gentamicin. Gentamicin belongs to the aminoglycoside antimicrobial agents. It is a bactericidal agent with a wide spectrum of activity against gram-negative and gram-positive organisms. It irreversibly inhibits protein biosynthesis by acting directly on the ribosome. Gentamicin binds receptors on the 30S subunit of the bacterial ribosome and inhibits protein synthesis through interference with the initiation complex, misreading of the code on the mRNA template, and causing polysomes to dissociate into non-functional monosomes. Ototoxicity and nephrotoxicity are the most serious adverse effects of gentamicin. Ototoxicity is manifested as vestibular dysfunction, which may be due to destruction of hair cells. If renal failure is present, the probability of ototoxicity is greater. Nephrotoxicity is more common with gentamicin than with any of the other aminoglycosides. It can produce acute renal insufficiency and tubular necrosis. Bacterial-acquired resistance to aminoglycoside antibiotic agents occurs by several mechanisms. From a clinical standpoint, which of these is most important? A. Inactivation by microbial enzymes. B. Retarded penetration of the drug through pores in the microbial outer membrane. C. Alteration of microbial ribosomal structure. D. Failure of the drug to penetrate the microbial cytoplasmic membrane. Bacterial-acquired resistance to aminoglycoside antibiotic agents occurs by several mechanisms. From a clinical standpoint, which of these is most important? A. Inactivation by microbial enzymes. B. Retarded penetration of the drug through pores in the microbial outer membrane. C. Alteration of microbial ribosomal structure. D. Failure of the drug to penetrate the microbial cytoplasmic membrane. A 37-year-old man is admitted to the hospital after being diagnosed with tuberculosis. Before treatment is started, you inform him about the most common ways of transmitting the tubercle bacillus, as well as the medications used, isoniazid, rifampin, and pyrazinamide. What is a common side effect of rifampin therapy? A. Reddish body fluids. B. Jaundice. C. Hyperrhythmia. D. Polyneuropathy. E. Muscle pain. The answer is A. Reddish body fluids. Initial treatment for pulmonary or extrapulmonary tuberculosis is isoniazid, INH, rifampin, RMP, and pyrazinamide, PZEA, as a short-course intensive daily regimen for 2 months, followed by INH and RMP for 4 more months. The most common side effects of rifampin are reddish urine and stool, saliva, sweat, tears, diarrhea, joint pain, back pain, swelling of feet and/or legs, and blood in urine. Rifampicin is an intensely red solid, and this is the reason for the body fluid discoloration. Hyperrhythmia is a major toxic effect of pyrazinamide. Other toxic effects include fever, indigestion, urticaria, photosensitivity, and joint pain. Isoniazid can cause polyneuropathy, jaundice, muscle pain, confusion, and unsteady walk. A nurse in your office may have been exposed to blood from a patient with AIDS. She was administering an antibiotic injection intramuscularly to a HIV-positive patient and accidentally sustained a needle prick injury. As part of her post-exposure prophylaxis therapy, you instruct her to begin daily tenofovir. What is the mode of action of this medication? A. Is an extremely effective inhibitor of the host cell RNA polymerase. B. Prevents the virus from entering the cells. C. Is incorporated into viral DNA as a purine analog causing chain termination. D. Blocks the viral enzyme in reverse transcriptase. E. Cannot be phosphorylated by host cell enzymes. The answer is D. Blocks the viral enzyme in reverse transcriptase. Tenofovir is categorized as a nucleoside analog reverse transcriptase inhibitor, NRTase. An NRTI's mechanism of action is to block reverse transcriptase, an enzyme that enables the human immunodeficiency virus 1, HIV-1, to flourish. This enzyme aids the HIV virus in making a copy of DNA from the viral RNA, and this DNA is incorporated into the host genome. The effectiveness has been found in a review conducted by the Centers for Disease Control and Prevention to be so effective that pre-exposure prophylaxis can potentially be a vital option for HIV prevention in early at very high risk for infection, whether through sexual transmission or injecting drug use. In regards to post-exposure prophylaxis, PEP, the United States Public Health Service recommend the use of tenofovir, emtricitabine, or a combination drug of these 2 medications, plus raltegravir for PEP in occupational exposure scenarios. The answer is E. Flucytosine. All of the drugs are antifungal agents, but only flucytosine has been associated with bone marrow suppression and synergizes with other drugs which suppress bone marrow functions. Meconazole and ketoconazole may produce hepatotoxicity, gastrointestinal upset and headaches. Amphotericin B may produce nephrotoxicity, while itraconazole is associated with gastrointestinal upset and rare liver dysfunction. Which of the following antifungal agents is associated with bone marrow suppression and renal failure? A. Itraconazole. B. Ketoconazole. C. Meconazole. D. Amphotericin B. E. Flucytosine. The other mechanisms listed are utilized by other antimicrobial agents. For example, all beta-lactam drugs are selective inhibitors of cell wall synthesis, and therefore active against growing bacteria. Sulfonamides are structural analogues of PABA that is necessary for folic acid synthesis. By competitive inhibition, the drug interferes with folic acid synthesis. Folic acid is an important precursor to the synthesis of nucleic acids. Quinolones are examples of antibiotics which inhibit bacterial DNA synthesis by blocking of the DNA gyrase. Antibiotics, polymyxin and colistin, and the antifungal agent amphotericin B act by inhibiting cell membrane function. The tetracyclines are a group of widely used broad-spectrum antibiotics. Antimicrobial activity of tetracyclines involves which of the following mechanisms? A. Inhibition of cell membrane function. B. Inhibition of microbial DNA gyrase. C. Inhibition of microbial protein synthesis. D. Inhibition of microbial cell wall synthesis. E. Inhibition of microbial folic acid synthesis. The tetracycline antibiotics possess a wide range of antimicrobial activity against gram-positive and gram-negative bacteria, as well as rickettsia, mycoplasma, chlamydia, ureaplasma, some atypical mycobacteria, and amoebae. These drugs are primarily bacteriostatic and act by inhibiting microbial protein synthesis. The tetracyclines, after active transport into the cell, bind to the 30S ribosomal subunit. This prevents the access of amino acid tRNA to the acceptor site on the mRNA ribosome complex, inhibiting the addition of amino acids to the growing peptide chain. This effect is, for the most part, reversible, and removal of the drug results in loss of action. You are prophylactically treating an 84-year-old man with amantadine and vaccination for avoidance of an upcoming influenza outbreak. The patient is to receive 100 mg BID for 8 days. What is the antiviral effect of amantadine? A. Amantadine binds to the hydrophobic sites on the influenza virus capsule. This destabilizes the virus, not allowing it to attach to the cell. B. Amantadine serves as a captoviral mRNA and prevents binding of reverse transcriptase. C. Amantadine binds to ICAM1, preventing viral attachment. D. Amantadine is phosphorylated by viral thymidine kinase and used as a defective guanosine analog in viral DNA synthesis. E. Amantadine prevents viral uncoating and inhibits production of viral mRNA. The answer is E. Amantadine prevents viral uncoating and inhibits production of viral mRNA. Amantadine only works after viral attachment to the cell, preventing viral uncoating. It is also believed to interfere with viral mRNA production. Amantadine is effective against influenza virus A. A patient comes to your office with a severe eye infection. You prescribe eye drops containing a mixture of the antibiotics gramicidin, neomycin, and polymyxin B. What does the mechanism by which neomycin acts as an antibacterial agent involve? A. Inhibiting protein synthesis. B. Inhibiting DNA replication. C. Stimulating translation. D. Preventing cell wall synthesis. E. Forming a channel in the membrane. The answer is A. Inhibiting protein synthesis. Neomycin belongs to the aminoglycoside antibiotics. They act by inhibiting the 30S subunit in protein synthesis. Neomycin, when given orally, is not absorbed from the gastrointestinal tract and has been used as a preventive measure for hepatic encephalopathy and hypercholesterolemia. By killing bacteria in the intestinal tract, it keeps ammonia levels low and prevents hepatic encephalopathy, especially prior to GI surgery. It works as an antibiotic that is active against streptomycin-resistant bacteria, including in the case of tuberculosis organisms. It has also been used to treat small intestinal bacterial overgrowth. It is not given via injection, as neomycin is extremely nephrotoxic even when compared to other aminoglycosides. The exception is when neomycin is included, in very small quantities, as a preservative in some vaccines, typically 25 micrograms per dose. Which of the following is a common feature of the antiviral action of AZT and acyclovir compounds? A. Must be activated by host cell enzymes to be effective. B. Act by alkylating viral DNA. C. Block virus from entering cells. D. Are active in the unphosphorylated form. E. Are analogues of purine nucleotides. The answer is A. Must be activated by host cell enzymes to be effective. 3-azido-3-deoxythymidine, AZT, is a nucleoside analog that blocks HIV replication by inhibiting the RNA-dependent polymerase, HIV DNA polymerase. The DNA polymerase from HIV is 100-fold more sensitive to AZT than the host polymerase. AZT is a pyrimidine analog that is phosphorylated to AZT triphosphate bicellular enzymes and acts as a competitive inhibitor of the reverse transcriptase. AZT can be incorporated into viral DNA and cause chain termination because its structure lacks the 2-hydroxyl needed for addition of the next nucleotide by the polymerase. In addition to nucleoside analogues, HAART, highly active antiretroviral therapy, also contains non-nucleoside reverse transcriptase inhibitors and protease inhibitors that block cleavage of the precursors of the viral coat proteins, preventing proper viral assembly. Maraviroc blocks a specific cell receptor needed by HIV to enter the host cell. A 32-year-old female presents to your clinic with recurrent bacterial cystitis. You culture Proteus sp. from the bladder and start her on amikacin. She presents 1 week later, with no improvement. Resistance to amikacin can occur by several methods. Which one of the following methods best describes a mechanism in which an organism can become resistant to amikacin? A. Decrease in solubility in the bacterial cell membrane. B. Enzymatic hydrolysis by beta-lactamase producing bacteria. C. Inactivation of amikacin by bacterial acetylation. D. Loss of the receptor on the 50S ribosomal subunit. E. Degradation of amikacin by bacterial peroxidase. The answer is C. Inactivation of amikacin by bacterial acetylation. Amikacin binds to the 30S ribosomal subunit, not the 50S. Enzymatic hydrolysis by beta-lactamase producing bacteria targets penicillins. Bacterial resistance to amikacin can be mediated through loss of a receptor by which amikacin binds the 30S ribosomal subunit, interference with membrane transport, and bacterial acetylation, adenylation, or phosphorylation. Amikacin is resistant to peroxidase. Amikacin is only marginally soluble in the bacterial cell membrane to begin with. Which of the following antifungal agents interacts with cytochrome P450-dependent sterol 14-demethylase to inhibit ergosterol synthesis in many fungal organisms, as well as in gram-positive bacteria and protozoans? A. Ketoconazole. B. Amphotericin B. C. Flucytosine. D. Zidovudine. E. Griseoflavine. The answer is A. Ketoconazole. The mechanism of amphotericin B involves ergosterol, but the mechanism is not related to ergosterol synthesis. Amphotericin B binds to ergosterol in the cell membrane, disrupting its permeability to ions. Ketoconazole and other imidazoles interact with cytochrome P450 to inhibit P450-dependent synthesis of ergosterol by sterol 14-demethylase. Griseoflavine interacts with microtubular protein to inhibit fungal mitosis. Flucytosine incorporates into RNA and disrupts fungal protein synthesis. Zidovudine is used primarily as an antibiotic and not as an antifungal agent. Antibiotics that inhibit bacterial cell wall synthesis include which of the following? A. Quinolones. B. Aminoglycosides. C. Tetracyclines. D. Sulfonamides. E. Vancomycin. The answer is E. Vancomycin. Vancomycin is the correct answer. Antibiotics that inhibit bacterial cell wall synthesis include the beta-lactam antibiotics, penicillins and cephalosporins, vancomycin, and bacitracin. Which is a glycoprotein, produced by many mammalian cells, and used in the treatment of hepatitis, papillomaviruses, hairy cell leukemia and AIDS-related Kaposi's sarcoma. A. Acyclovir. B. Zalcitabine. C. Idaguridine. D. Interferon. E. Zidovudine. The answer is D. Interferon. All the listed agents are synthetic analogues, except interferon, which is a glycoprotein produced by many types of mammalian cells. It has been shown to be useful in treatment of hepatitis, papillomaviruses, hairy cell leukemia and AIDS-related Kaposi's sarcoma. Idaguridine, as its name implies, is a synthetic pyrimidine analog, which inhibits viral DNA polymerase. Zidovudine and zalcitabine are also synthetic pyrimidine analogues, but they inhibit reverse transcriptase and act as chain terminators. Acyclovir is a synthetic purine analog which requires viral thymidine kinase to be converted to an active phosphorylated form, which then inhibits viral DNA polymerase. Certain helminthic infestations can spread to the CNS. Pretreatment with which class of drugs is required prior to diethylcarbamazine administration? A. Diuretics. B. Antiviral drugs. C. Anticoagulants. D. Opiates. E. Steroids. The answer is E. Steroids. LoLo is an extraintestinal nematode, which may migrate to the CNS, causing encephalitis. Diethylcarbamazine is successful in treating LoLo but will exacerbate the encephalitis unless steroids are used first to treat the symptoms of the encephalitis. Other side effects of diethylcarbamazine may be due to rapid death of nematodes and release of various toxic substances. Symptomatic treatment might be appropriate with a number of pharmacological classes, but most symptoms will resolve as the body is cleared of dead and dying nematodes. A 52-year-old man presents with a 3-day history of persistent diarrhea, having up to 7 watery bowel movements without bleeding a day. He has associated lower abdominal cramping and notes mild nausea. He denies travel outside of the country. He does not recall eating anything unusual, and none of his family members are sick. Past medical history is significant for GERD, for which he takes Protonix daily. He recently had an upper respiratory infection and completed a course of oral levofloxacin approximately 3 weeks ago. A stool sample is obtained. Stool is negative for ova and parasites, but PCR testing is positive for Clostridium difficile. What is the appropriate first-line treatment in this patient? A. Metronidazole. B. Prednisone. C. Clindamycin. D. Loperamide. E. Lamotrigine. The answer is A. Metronidazole. The patient is infected with Clostridium difficile, a gram-positive, spore-forming bacillus. It is manifested by watery diarrhea, which left untreated can progress to fulminant colitis. Previous antibiotic use is the leading cause of Clostridium difficile, as the use of antibiotics alters the normal colonic flora, allowing Clostridium difficile to proliferate. Patients who have confirmed infection should first discontinue any offending antibiotics. The patient is then treated with either oral metronidazole or oral vancomycin. Due to its cost, oral vancomycin is typically reserved for severe or recurrent cases of Clostridium difficile. Which of the following drugs is useful in treating infections from Mycobacteria leprae? A. Isoniazid. B. Pyrazinamide. C. Cyclosarin. D. Dapsone. E. Ethambutol. The answer is D. Dapsone. Dapsone has been the worldwide standard for treatment of leprosy. The other agents listed are used in treatment of tuberculosis. Leprosy, also called Hansen's disease, is a long-term infection caused by the bacteria Mycobacterium leprae or Mycobacterium lepromatosis. It affects the skin, mucous membranes, and nerves, causing discoloration and lumps on the skin. A 30-year-old man with HIV is being treated with antiviral agents. 4 weeks after initiating therapy, he presents with weakness and fatigue. Laboratory studies reveal anemia, leukopenia and thrombocytopenia indicating bone marrow suppression. What antiviral agent is most likely the cause of his symptoms? A. Tenofovir. B. Zidovudine. C. Nelfenavir. D. Acyclovir. E. Lamivudine. The answer is B. Zidovudine. Zidovudine, ZDV, formerly called azithromycin, is active orally and is distributed to most tissues. The primary toxic side effect of ZDV is bone marrow suppression leading to anemia and neutropenia, which may require transfusions. Additional side effects include thrombocytopenia, gastrointestinal distress, headache, myalgia, acute cholestatic hepatitis, agitation, and insomnia. The other choices are incorrect. Acyclovir is commonly used for the treatment of mucocutaneous and genital herpes lesions and for prophylaxis in AIDS. Acyclovir has no significant toxicity on the bone marrow. Nelfenavir is a protease inhibitor that is characterized by a short half-life and has a number of drug interactions, but its primary adverse effect is diarrhea and it has the most favorable safety profile in pregnancy. It is not associated with bone marrow suppression. Lamivudine is a nucleoside inhibitor and is an active inhibitor of HIV reverse transcriptase. It is used in the treatment of hepatitis B virus infection. The drug is remarkably non-toxic and adverse effects are mild. Tenofovir is a nucleoside reverse transcriptase inhibitor and anti-HIV drug that competitively inhibits reverse transcriptase and causes chain termination after incorporation into DNA. Adverse side effects include gastrointestinal distress, asthenia, and headache but not anemia, leukopenia, or thrombocytopenia. Which of the following is an analog of guanine, a purine, and is transformed by viral thymidine kinase before it can inhibit viral DNA polymerase in viruses that are actively replicating? A. Zalcytabine. B. Interferon. C. Idaxuridine. D. Acyclovir. E. Zidovudine. The answer is D. Acyclovir. The chemical type of an antiviral compound is often important in determining its potential mechanisms and, therefore, its utility against specific types of viruses. Interferon is a glycoprotein produced by many types of mammalian cells. It stimulates host mechanisms to prevent viral penetration and also inhibits viral protein synthesis. Idaxuridine, as its name implies, is a pyrimidine, which inhibits viral DNA polymerase. Zidovudine and zalcytabine are also pyrimidines, but they inhibit reverse transcriptase and act as chain terminators. Only acyclovir is a purine that requires viral thymidine kinase to be converted to an active phosphorylated form, which then inhibits viral DNA polymerase. Which of the following anthelminthic drugs must be administered intravenously and may cause albuminuria due to accumulation in the kidney, photophobia, and papillary eruption? A. Zidovudine. B. Praziquantel. C. Suramin. D. Diethylcarbamazine. E. Ivermectin. The answer is C. Suramin. Suramin must be administered intravenously and should be used cautiously in patients with kidney disease. It inhibits protein kinases and dihydrofolate reductase and reduces ATP synthesis. It is used in the treatment of certain extraintestinal nematodes and is probably one of the most toxic anthelminthic agents. The other choices are incorrect. Diethylcarbamazine is rapidly absorbed following oral administration and increases the susceptibility of extraintestinal nematodes to host antibodies. Ivermectin is used to treat onchocerca volvulus in humans and is rapidly absorbed following oral administration. The primary use of praziquantel, which is rapidly absorbed orally, is in the treatment of infection from flatworms and flukes where it reduces the resistance of the parasite to host immune mechanisms. Zidovudine is also administered orally, but is used for treatment of AIDS, where most of its toxic symptoms are hematologic. A 42-year-old immigrant from Pakistan comes to your office after his wife noted hypopigmented anesthetic patches on his back. On further examination, you discover bilaterally thickened ulnar nerves. Skin biopsy reveals numerous acid-fast bacilli and a negative lepromin test. What combination of drugs would you recommend for this patient? A. Ethambutol, isoniazid, clofazimine. B. Dapsone, clofazimine, rifampin. C. Pyrazinamide, rifampin, isoniazid. D. Dapsone, clofazimine, ethambutol. E. Isoniazid, rifampin, dapsone. The answer is B. Dapsone, clofazimine, rifampin. Combination therapy is recommended for all types of leprosy to avoid the emergence of resistance. Cases of lepromatous leprosy are treated with a combination therapy involving the use of the following: dapsone, rifampin, clofazimine. This combination is given for 2 to 3 years, ideally till the skin biopsies are negative. Combination therapy is recommended for all types of leprosy to avoid the emergence of resistance. Cases of lepromatous leprosy are treated with a combination therapy involving the use of the following: dapsone, rifampin, clofazimine. This combination is given for 2 to 3 years, ideally till the skin biopsies are negative. Cases of indeterminate, borderline, and tuberculoid leprosy are treated with a combination therapy involving the use of the following: dapsone, rifampin for 6 to 12 months followed by dapsone, alone, for 2 years. Foscarnet is toxic to which of the following organs? A. Bladder. B. Liver. C. Heart. D. Kidneys. The answer is D. Kidneys. Foscarnet is an antiviral medication which is primarily used to treat viral infections involving the herpes viridae family. It can cause damage to the kidneys. To reduce the damaging effect, the patient may be put on intravenous fluids. What is acyclovir's mechanism of action? A. Reverse transcriptase blocker. B. M2 channel inhibitor. C. Guanosine analog. D. Neuraminidase inhibitor. The answer is C. Guanosine analog. Acyclovir is a guanosine analog, which works by inhibiting viral DNA polymerase. This slows down the rate at which viruses can replicate. Acyclovir is used primarily in the treatment of herpes simplex viruses 1 and 2, chickenpox, and shingles. Allopurinol is used for what condition? A. Gout. B. Hypertension. C. Kidney stones. D. Type 2 diabetes. The answer is A. Gout. Allopurinol is a purine analog and xanthine oxidase inhibitor used in the treatment of chronic gout. Which of the following drugs is used in the treatment of osteoporosis? A. Budesonide, formoterol. B. Sitagliptin. C. Alendronic acid. D. Infliximab. The answer is C. Alendronic acid. Alendronic acid, trade name Fosamax, is a bisphosphonate used in the treatment of osteoporosis. Bisphosphonates reduce bone loss by encouraging apoptosis in osteoclasts. Infliximab is a tumor necrosis factor alpha, TNF-alpha, blocker used in the treatment of rheumatoid arthritis and several other autoimmune conditions. Sitagliptin, trade name Januvia, is a diabetes medication. Budesonide, formoterol, trade name Symbicort, is a combination long-acting beta agonist and corticosteroid used in the treatment of asthma. The answer is D. To drink 3,000 milliliters of fluid a day. The nurse should instruct a patient on allopurinol to drink 3,000 milliliters of fluid a day to reduce the risk of kidney stone formation. When allopurinol is prescribed to a client, it is best for the nurse to include the following instructions. A. That the effect of the medication will occur immediately. B. To take the medication on an empty stomach. C. That if swelling of the lips occurs, this is a normal expected response. D. To drink 3,000 milliliters of fluid a day. The client prescribed cholesterol and has been given instructions for taking the medication. The nurse would recognize a need for further instructions if the client said, A. I will store the medication at room temperature. B. A high-fiber diet is important while taking this medication. C. This medication will help lower my cholesterol. D. This medication should only be taken with water. The answer is D. This medication should only be taken with water. Cholestyramine is a bile acid sequestrant, which binds bile in the gastrointestinal tract to prevent its reabsorption. It removes bile acids from the body by forming insoluble complexes with bile acids in the intestine, which are then excreted in the feces. As a result of this loss of bile acids, more plasma cholesterol is converted to bile acids in the liver to normalize levels. This conversion of cholesterol into bile acids lowers plasma cholesterol levels. It should be taken with meals and water. The dosage should be administered once or twice daily, with a maximum of 6 times daily. Cholestyramine binds bile in the gastrointestinal tract to prevent its reabsorption. Which of the following is a potential side effect of prednisone? A. Adrenal suppression. B. Weight gain. C. Hyperglycemia and diabetes. D. All of these. The answer is D. All of these. There are many potential side effects of prednisone, including all those listed in the answer choices: headache, fatigue, acne, seizures, upset stomach, changes in mood, difficulty breathing, dry cough, vomiting, depression, heartburn, muscle weakness, irregular heartbeat, tremors, inability to properly thermoregulate, and many others. The nurse anticipates administration of milk of magnesia, magnesium hydroxide. Which of the following patient conditions may affect the nurse's decision to administer magnesium hydroxide? A. Indigestion. B. Constipation. C. Peptic ulcer. D. Stress ulcer. E. Reflux esophagitis. The answer is B. Constipation. The nurse must consider potential side effects of medications before administering them. Milk of magnesia, magnesium hydroxide, has 3 major actions. Anti-ulcer action: magnesium hydroxide neutralizes gastric acid, decreasing the direct acid irritant effect. This increases pH, which, in turn, leads to pepsin inactivation. Drug also enhances mucosal barrier integrity and improves gastric and esophageal sphincter tone. Antacid action: drug reacts rapidly with hydrochloric acid in the stomach to form magnesium chloride and water. Laxative action: magnesium hydroxide produces its laxative effect by increasing the osmotic gradient in the gut and drawing in water, causing distension that stimulates peristalsis and bowel evacuation. The laxative action of magnesium hydrochloride can exacerbate the patient's current condition if he is constipated. The psychiatric nurse cares for a patient with major depressive disorder admitted after a suicide attempt. The primary care provider has prescribed fluoxetine, which the patient has never taken before. Which of the following statements is important for the nurse to say to the patient? A. You should take this medication in the morning because it can cause insomnia. B. This medication takes at least 4 weeks to work. C. You may experience changes in your bowel movements such as diarrhea or constipation. D. You may experience changes in appetite and weight. E. You could begin to feel more anxious. The answer is B. This medication takes at least 4 weeks to work. Fluoxetine is a selective serotonin reuptake inhibitor, SSRI, commonly prescribed to patients diagnosed with depression. It may cause changes in appetite and weight, increase anxiety and insomnia, or cause bradycardia or palpitations. It is most important for the nurse to educate the patient that the therapeutic effect of fluoxetine may take up to 4 weeks, as the patient has a previous suicide attempt, and may experience suicide ideation before the effect occurs. The nurse prepares to administer medications on the psychiatric unit. The patient is prescribed phenelzine sulfate for depression. Which of the following is the nurse's priority education when administering this medication? A. Effect of medication takes 3-4 weeks to work. B. Avoid tricyclic medications until 3 weeks after stopping. C. Potentiates alcohol and other medications. D. Avoid foods with tyramine. E. Wear sunblock. The answer is D. Avoid foods with tyramine. Phenelzine is a monoamine oxidase inhibitor, MI, that treats depression. Patients who take MIs should avoid foods with tyramine due to an increased risk for hypertensive crisis. Tyramine-rich foods include those that are fermented, heavily marinated, pickled, smoked, or heavily marinated. Also, chocolate and alcoholic beverages have significant amounts of tyramine. In addition to education about diet modification, nurses must educate patients of the signs of hypertensive crisis, which are headache, sweating, palpitations, stiff neck, and intracranial hemorrhage. All of the other listed patient educations are essential, but the priority is to avoid tyramine due to the risk for hypertensive crisis, which is life-threatening. A client being treated for type 2 diabetes has recently been prescribed an oral hyperglycemic medication and has inquired how the medications will keep his blood sugar levels under control. The nurse informs the patient the medication prescribed will reduce glucose production by the liver and increase insulin sensitivity but will not increase insulin production. Based on this description, which diabetic medication has this client been prescribed? A. Metformin. B. Sitagliptin. C. Exenatide. D. Glipizide. E. Glyburide. The answer is A. Metformin. The only medication mentioned that does not actually stimulate insulin production is metformin. This medication is a biguanide. Its mechanism of action includes decreasing hepatic glucose production, and increases insulin sensitivity. A 26-year-old pregnant client presents to labor and delivery and premature labor. The doctor has ordered a tocolytic medication to help in stopping the contractions. Which of the following medications is effective in managing premature labor contractions? A. Pitocin. B. Naproxen. C. Terbutaline sulfate. D. Calcium gluconate. E. Misoprostol. The answer is C. Terbutaline sulfate. Terbutaline sulfate is a tocolytic agent, as well as a bronchodilator effective in stopping premature labor contractions. Both pitocin and misoprostol are used to induce labor. Calcium gluconate in labor is used to reverse magnesium sulfate, another tocolytic. Naproxen is an NSAID. You are the nurse at a psychiatry clinic taking care of a 47-year-old male who complains of 3 months of depressed mood and fatigue. His physician starts him on venlafaxine. Which of the following best describes the mechanism of action of venlafaxine? A. Beta-adrenergic blocker. B. GABA agonist. C. Selective serotonin reuptake inhibitor, SSRI. D. Serotonin norepinephrine reuptake inhibitor, SNRI. E. Monoamine oxidase inhibitor, MAOI. The answer is D. Serotonin norepinephrine reuptake inhibitor, SNRI. Venlafaxine functions by blocking the reuptake of both serotonin and norepinephrine, and thus is classified as a serotonin norepinephrine reuptake inhibitor, SNRI. Venlafaxine is used to treat a number of conditions including depression, anxiety, panic attacks, and social phobia, among others. In addition to its antidepressant properties, it is also useful in that it can provide the benefit of increased energy in some patients due to the norepinephrine reuptake inhibition, effectively increasing the effect of norepinephrine. Selective serotonin reuptake inhibition, SSRI, is incorrect because venlafaxine is an SNRI, not an SSRI. An example of an SSRI is fluoxetine. Monoamine oxidase inhibition, MAOI, is incorrect because venlafaxine is an SNRI, not an MAOI. An example of an MAOI is phenelzine. An example of a GABA agonist is phenobarbital, a barbiturate. An example of a beta-adrenergic blocker is propranolol. You are the nurse taking care of a 24-year-old female with major depressive disorder. She is started on phenelzine, a monoamine oxidase inhibitor, MAOI. To avoid serious adverse effects, including hypertensive crisis, you should warn her to avoid which of the following foods? A. Aged cheeses. B. Carrots. C. Green, leafy vegetables. D. Grapefruit juice. E. Beets. The answer is A. Aged cheeses. MAOIs, when combined with food or drink products containing the metabolite, pteramine, have the potential to cause serious adverse effects including hypertensive crisis. Tyramine is found most commonly in aged cheeses and cured meats. Thus, since this patient is taking an MAOI, she should be advised to avoid aged cheeses. Carrots, beets, grapefruit juice, and green, leafy vegetables do not need to be avoided in patients taking MAOIs. You are the nurse taking care of a patient with schizophrenia. You administer the patient's medications and note that he is receiving haloperidol. Which of the following best describes the mechanism of action of haloperidol? A. Norepinephrine dopamine reuptake inhibitor. B. Increased efficiency of GABA receptor binding. C. Selective serotonin reuptake inhibitor. D. Serotonin norepinephrine reuptake inhibitor. E. Dopamine D2 receptor antagonist. The answer is E. Dopamine D2 receptor antagonist. Haloperidol is a first-generation antipsychotic, also known as a typical antipsychotic medication, and functions by selectively antagonizing dopaminergic D2 receptors. Haloperidol is used to treat a number of conditions including schizophrenia, bipolar disorder, manic phase, acute psychosis, tics from Tourette syndrome, and delirium, among others. Increased efficiency of GABA receptor binding describes the mechanism of action of benzodiazepines, not haloperidol. Selective serotonin reuptake inhibition does not describe the mechanism of action of haloperidol. This describes medications like fluoxetine and escitalopram. Serotonin norepinephrine reuptake inhibition does not describe the mechanism of action of haloperidol. This describes medications like venlafaxine and desvenlafaxine. Norepinephrine dopamine reuptake inhibition does not describe the mechanism of action of haloperidol. This describes medications like bupropion and methylphenidate.